This is the QD Clinic Challenge, stills or not. Hi, I'm Jack Cush with Room Now. Today's case is actually a CPC from the New England Journal, 1989. Look it up fast, and then maybe you can tell me whether this is stills or not. A 59-year-old white female is admitted to the hospital with a 4-week history that began with a sore throat, was followed by spiking fevers and profound weakness. There was myalgias, there was arthralgias. A month earlier, she started with a facial palsy and then a sore throat. He went to a primary care doctor, was given antibiotics. That didn't stop the fevers, although the sore throats sort of waned. In the ensuing weeks, the patient became progressively weak, anorexic, had high fevers and chills daily. She had nausea and vomiting the day prior to admission. And while she had significant weight loss at presentation, there was no chest pain, no rash, no visual symptoms, no difficulty swallowing. So when she was examined, she was thought to be acutely ill. Her temperature was 40 degrees centigrade, 104 Fahrenheit. She was thin from her weight loss. She was found to have an enlarged spleen, an enlarged liver, and had a truncal rash. Examination revealed swelling of the knees with an effusion bilaterally. On either chest x-ray or exam, she was found to have a pleural effusion. Her white count was 13.6 with a left shift. Her H&H was 7/29. Her platelets were 175,000. The ESR was 119. The AST was more than double at 87, and the albumin was a little bit low at 3.2. Lab tests were negative for ANA, rheumatoid factor, hepatitis B, hepatitis C, Lyme titers, and heterophile antibodies. And as always is the case with the New England Journal CPC, a diagnostic test was performed. Now, what diagnostic test would you do here? Of the things that you can point to and stick a needle in or get tissue on, the sore throat's gone. She has a rash. You could biopsy that. The liver and spleen are enlarged. Generally, you wouldn't want to do that unless you had good cause to biopsy the liver. I don't know that the workup has been complete enough to warrant that. Pleural effusions, you could tap it. You could maybe get a pleural biopsy, although that wouldn't be your first move here. The bottom line is I wouldn't do a diagnostic test here because I would first subject the patient to the criteria we have for Still's disease, that you can check the boxes and figure out whether this meets criteria at least. Now, obviously, a presentation like this, a temperature of 40, a pleural effusion, weakness, weight loss, you're going to do a bunch of things. You do blood cultures and infection workup. You're going to do probably a CT of the abdomen and chest and maybe pelvis. There's other serologies that one might do. But let's then go to the criteria. And you can do this easily by going to the new website that we started, stillsnow.com, and look for the diagnosis calculator where you can check boxes on symptoms and it'll calculate for you. If you look up the criteria, either my criteria, the Cush criteria published in Bulletin of Rheumatic Diseases, actually I came up with this when I was working in Pittsburgh in 1984, or the Yamaguchi criteria from 1992, they both have major criteria and minor criteria, so they're a little confusing to deal with. But if you think about the case we just had, quotidian fevers, major criteria, this is the Cush criteria. There's 5 major criteria. Quotidian fever greater than 39, the Still's rash, simultaneous elevation of white count and SED rate, seronegativity, and carpal ankylosis. You get 2 points for each of those. This patient has 4 out of those 5, so it has 8 points. Now you only need 2 more points to make the diagnosis. And again, minor criteria get 1 point each. Age less than 35. How old was she? She was 59. Oops, doesn't make that criterion. Arthritis, polyarthritis, yes. Prodromal sore throat, yes. LFTs, yes. Serositis, yes. Cervical or tarsal ankylosis, no. So she's got, it looks like 12 points, and I would say a certain diagnosis. If you did the Yamaguchi criteria, the Yamaguchi criteria has major criteria as fever greater than 39, arthralgias greater than 2 weeks, Still's rash, and a neutrophilic leukocytosis. The patient has all of those. To have the Yamaguchi criteria, you have to have 2 major. She meets that criterion and have a total of 5. Minor criteria in Yamaguchi are sore throat, lymphadenopathy, splenomegaly, hepatic dysfunction, and seronegativity. Minor criteria are met. There is sore throat, there is hepatic dysfunction, and there's seronegativity. So there you can help confirm this presumptive diagnosis, assuming that the cancer diagnosis, cancer workup, and the infectious workup would be negative. So you'll have to look up the paper to find out what diagnostic test was done. My guess is they went after a skin biopsy, and basically if you biopsy the liver, the skin, the lymph nodes, the spleen, muscle, it doesn't really matter in Still's disease. Non-specific inflammation is what you'll get. There are no diagnostic tests or procedures that one can do. That's it for this episode of QD Clinic.